medical status?
I'm going to be brief and straightforward. As you said, I should avoid answering the question directly. Look, according to this, you don't go straight up to treating a patient without asking any sort of medical history that's there. So what I did is we need to check the medical history of the individual before touching or even doing anything with them. We need to know whether they are sick with certain things. That's standard protocol in even any medical profession. Whether you are a dentist, whether you are an optometrist, you need to check that. So I did that. It's on record whereby I marked it and then the patient also signed. So from my recollection, I did that.
Ubongani Ntanzi uthi ke wena ke wambheka ke noma wamhlola ke umlomo kuphela awukazi umbuze ngesimo sakhe ke sokuthi ukanjani ke ngempilo lana kuthina ke awukwazi ke ukuthi ke noma uyiphi ke inhlobo kadokotela ukuthi ungavele uqonde nje odabeni nomuntu kufanele wazi ngomlando wakhe ke ukuthi ke ukanjani ke impilo yakhe akukho yini okumhluphayo ngenza lokho ke nami yilona le form leli eliphambi kwami.
Okay, regarding the HIV status, did you warn him that is not obliged to divulge his medical?
As I stated when I was stating here that we ask the patient that do they know their HIV status? And they said they are not aware, they don't know whether they are positive or negative. That's what we ask. We don't say whether the patient has the right. The question is, we don't say, are you HIV positive or are you HIV negative? We say, do you know? And if the patient decides to say, yes, I know, and then that's when we proceed to saying, then would you like to disclose? But if the patient just said they don't know, we're not gonna say what really happened. Further on, the things that we ask further on, it's, have you ever been tested? And then when the patient starts to say, no, I've never been tested, we leave it at that.
Mayelana ke nombuzo lona ke ophathelene nayo ke ingculaza ukuthi ke ingabe wami exwayisa yini ukuthi ke akaphoqelekile ukuthi aphendule. Lana ke wathi uma ngimbuza impendulo yakhe yathi cha angazi. Uma ethi ke angazi akukho okunye osungaphinda ukubuza. Kodwa ke uma impendulo yakhe kwakuwukuthi yebo ngiyazi, kula usewumxwayisa khona ke manje ukuthi noma usho kuyena ke ukuthi ungathanda yini ukudalula ukuthi ke sithinike. Kodwa uma ethe nje cha akazi awukwazi ukuthi usungaqhubeka ngayo.
All right. Did you check him? Did you check COVID on him?
During the time they passed through the screening process.
Did you check COVID?
Listen, they pass through screening. As I've already mentioned, that the patients before they get to us, they go through number of exams. It was COVID times. They go through the reception, they see the nurses, they do the blood pressure, and then they also do COVID screening. And they do that at a separate location. When they come to us, it's a patient that's clear of the screen of COVID, and also with the HIV screen, they also do the same thing. They ask them if they want to test, they end up testing them. So those things, screenings are done by the nurses, which we say is the vital group that does that. So they screen them for that. So there is no patient who will pass the vital group, come to us with signs of COVID. So there are people who were at the time by the government appointed to screen any patient that comes through there for COVID before they even get to us. My point is the patient passed through a number of people before getting to me.
Ingabe ambheka yini ke umskrinyala yona ke iCovid uthi lokho kwenziwa ke uma bengena ke lapha yana ke akangeke ezofika kumina ke kungekabhekwa konke lokho baningi abantu abadlula kubona ke lapha yana la kwenziwa iscreen khona kubhekelwa yona ke iCovid ngoba ngaleso sikhathi vele ke kwakuyisikhathi seCovid nayo ke iHIV nayo ke uyabuzwa lapha yana uma kukuthi umuntu unquma ukuthi ke attestwe ke nalapho kwenziwa khona lapho.
So was this form completed by yourself or by the nurse? The one that you were reading?
The form has two handwritings.
Yes.
The first one on top if you notice where there's written vitals, that's not my handwriting. You see, and you give any expert, handwriting expert, they will tell you there are two people who are writing here. The protocol is names, surnames, and including patients' contact details. They are done by the nurses there. And then the rest of the questionnaire, which is the questionnaire, the exam, the other part whereby we do the extra exams, it's done by us. So every detail that requires the patient's personal details and also the vitals, which I've already pointed out, if you can look at the form, that whether it's written BP inside here and also the time, it doesn't correlate with the other handwriting, which is mine. So meaning that this patient was seen and also the form was filled by the nurses. That's the protocol. They fill up the personal details. When they get to us, we only do the medical side.
Lana umubheka ke kule form lena ke ukuthi ke ama handwriting ahlukileke lapha eqaleni lapha yana kubhala imininingwane yakhe, igama, iminyaka, kunama number, kunekhili, lokho ke kwaqaliswa amanesi lapho aqala khona. Ukuhla ke enzansi la kubuzwa khona ke imibuzo noqhubeka ke neform I-handwriting yami.
And it is, tell me, in terms of that form, where it is indicated that the results after you check the COVID were positive or negative?
I'm going back.
Sorry?
I'm going back to what I said initially. It's a dental form.
Yes.
When a patient comes to the healthcare center, there is a file that's in brown and it has lines, it has different disciplines inside. The form that now I'm given here is for what I did. I did go through the rest of the form, and then the rest of the form is, when you go through them, you check whether the patient was screened for COVID or not, and then you send them back if they were not. We do receive it as a hard copy. Once we are done, we remove our part from the dental part. We store this part inside there. And most of the time when we store it, it's stored inside a system whereby it even has a correlating number with the actual document that's being kept by the medical side. This is done in order to avoid any complications between the dental side and the other side, because the patient might come back a week later with an appointment to us. We avoid the patient waiting in line again, trying to relocate file. Instead, the patient goes straight to us, and then we retrieve this file.
Ingabe lana kule form kukhona la yini khona ke kushoyo ukuthi wabhekwa ke ebhekelwa yona ke iCovid. Ngizobuyela kamuva ke noma ngibuyele emuva ke la engishilo ke khona ukuthi ke kune file sithola ke ifile kuleyo file leyo ke kuneyinhlaka ezahlukeneke la echazwa khona ke ukuthi lokhu ubhekelwe nalokhu ubhekelwe, bese thina ke kuleyo file le uma seniqedile ngikhiphe eyethu ifile noma lena iform lena ngisibeke ecaleni la igcinwa khona ke kwenzela ukuthi ke uma ngenzeke kule ipatient ibuye futhi ke kungabi ke nokunqobuzana ke la khona ke ezophinda futhi ayoma ke emgqeni kodwa ke lo muntu ebekade ekhona la.
The fact that I put it to you that you acted beyond the scope of the instruction, I'll just leave it for argument, but I'm just concerned about where you indicated that accused number 2 said he had a heart problem in 2014. It was an incident from the mine. And you further said that he did not take any medication in relation to that. When you were told, you said you were told by accused number 2 that he had a heart problem. Is that what you say? Were you told by accused number 2?
And then I'm going back to the form that I have. If you look at the form, the things that you're asking me, they're basically almost answered here. The health questionnaire asks if the patient had any sort of heart conditions or there are any sort of medication.
Yes.
So I need to ask those things. It's not beyond scope. It's beyond what the form.
The question is,
saying.
Were you told by accused number 2?
Yes.
Yes, that's what I want.
Yebo ngatshela uyeke ukuthi wayenenkinga ke enhliziyo ekwenzeka ke emayini ngo-2014.
My instruction is that accused number 2, where he was working, he's working underground. And no one can work underground. You can comment, you cannot comment, but this is what I'm putting to you as the instruction of accused number 2, is that if you have sicknesses or chronic illnesses, you cannot work because it's too hot underneath. Any person with medical defects cannot work there.
Can I?
So he denies having informed you that he had the medical.
Can I add? In regards to what you're saying, it's true. There's no denying in that. But also there is also a fact that most of the people that work underground, the studies that's been there, and also if you look up through the internet, you'll find it. Most people that work underground, most of them, they are always checked through for if they have any sort of defect or whatsoever. But did you realize that there's a fact that if a patient has a high blood pressure, what the mines people do is they send the patient to a doctor so that they can have that rectified and managed before they go back underground. It depends on the severity of the situation. So in the terms of, that's now what I was informed, and that's what it came from him. That's what he said. So meaning that yes, he could have had a mining incident. We don't know whether it's minor, whether it's major, and then after a while, and then the patient was fine, and then they went back. So those things are the things that any logistics from the mine that we know, because when I was working that side, we used to have clients that they would basically almost, when I interacting with my colleagues, that they would come, they need to be checked, they need a medical certificate to show that whatever they had, it's not serious, they can go back underground and then work.
Yes.
Wazi-ke ukuthi kwizimo-ke ekusetshenzwa ngaphansi kwazo emayini ukuthi-ke kuyashisa laphayana, angeke umuntu asebenzeke enesimo esenhliziyo. Kungayiqiniso-ke lokho okushoyo, kodwa-ke kuyenzeka-ke futhi amahlandla amaningi futhi-ke lokhu-ke sekuboniwe-ke noma ama-study akhona-ke ashoyo ukuthi abantu bayasebenza khona laphayana ezansi, kuya ngokuthi isimo siyalawuleka noma-ke sikanjani-ke. Abanye bayeza bazobona udokotela, umuntu azothi-ke ngicela nje incwadi-ke yokuthi nje babone ukuthi lapha manje isimo sami-ke sesiyalawuleka-ke, ngingabuyela ngaphansi. So kuya ngokuthi isimo leso sikanjani.
Yes. Let's get into the point where you say, when my colleague was asking you about assault or if somebody alleges that he was choked. According to you, are you in a better position to see if somebody has been subjected or he was choked? Because I don't want to, sorry, let me just clarify this one. Unless the instruction is that the accused was not strangled. I want to make a distinction between the two. He was not strangled. According to his version, a plastic bag was put over his head when he was choked. A plastic bag was used. Will you able to see if a patient come to you that this person was choked?
In a normal state, any patient that was choken with a plastic bag, unless if the only person that can be able to say the patient was choking in a plastic bag, in medical terms, from what I know, the only evidence that can show that a person was choked in a plastic bag and then actually there is a sign is if a patient succumb to whatever the plastic bag was. If they was choked and they end up passing away, that's when only the autopsy from whoever's doing that, they'll be able to identify that. A choking of a plastic bag over the face, yes, ligature marks, if it was pulled hard here, there will be lines. Any plastic bag, if anyone, even right now, you take a bandage and you wrap it around your hand and you pull it quite very strong, it will leave a mark.
Uma-ke ukuthi-ke wafakwa-ke uplastic-ke, lokho-ke la ekungathola noma kubonwe khona-ke ukuthi-ke mase sithi-ke umuntu-ke mhlampe usuyashona-ke ngenxa yalokho, uma sekwenziwa yona-ke i-postmortem kuzobonakala. Kodwa-ke uma kuwukuthi yona-ke leyo plastic iboshiwe-ke khona lana-ke yasiyaqiniswa-ke kunama-mark ezowashiya. Ngisho nawe uma ungathatha ibandage khona manje uyibophe khona la kuwena-ke kuzobonakala noma-ke khona lokho okuzosala.
Before you continue, let me add, in that term, means that even if there was a mark by a plastic bag, after 3 days later, when the patient came to me, that mark would have eventually been faded or have actually disappeared, because of the fact that these marks that we were talking about, they are not severe marks that could last for long. Plastic bag doesn't have enough power compared to a rope.
Futhi-ke asithi-ke manje lo muntu uzile-ke useze emuva kwamalanga amathathu-ke lawo ma-marks lawo-ke kusengenzeka-ke ukuthi-ke ase enganyamalala-ke ngoba-ke i-plastic yona-ke ayifani-ke ama-mark ayo angeke ahlale-ke ngokufana nayo-ke intambo.
Yeah, all right, no, that one is not his field. I'm sorry. All right. Before I just want to be straightforward. When you first saw accused number 2, Bongan Dance, he had no visible injuries. Did you see any visible injuries?
From my point of view,
Umbona kwami-ke mina-ke akukho kulimala okwakubonakala loba okwakucaceleke engakubona kuyena.
And you did not ask him to take out his clothes?
no, I never did that.
Angizange ngimcele nokuthi-ke akhumuleke owayegqokile.
And tell me the time in which they arrived. And what was the time accused number 2 was brought to you? What exact time was it?
It was right precisely towards lunch. I think I remember it was towards maybe 1 o'clock. I think it was around 12.
Ngizothi-ke ngaboma-12-ke kodwa nje ngaphambi kokuthi-ke kushaye ihora-ke lokuthi-ke kube isidlo-ke sasemini.
So that's when you commenced your examination, 12, towards 1 o'clock.
Leso sikhathi-ke ngaqala ngaso-ke ukuthi-ke ngimhloleke ngimbheke.
In that documentation, it reflects 12:56. Is it the correct?
12:52.
12:52. Beg your pardon. So, what was the time you concluded your examination?
I would say maybe it's roughly maybe 30 or 45 minutes later, because I remember it extended to lunch, then we went to lunch.
Ngizothi-ke kwathatha-ke isikhathi ngango-30 minutes kuye ku-40 minutes ngoba ngiyazi-ke ukuthi-ke kwase ngidlulela kwisikhathi sethu-ke se-lunch sase sithatha-ke i-lunch.
Could it be 1:30?
I wouldn't be precisely sure.
No, could it be? Plus or minus, or approximately?
Approximately, maybe.
Ngasho-ke ukuthi labo kuma 1:30.
The last question is, let me just confirm if. Okay, sure. Thank you, sir. You said you graduated in 2019, if I heard you correctly.
Yebo, izifundo zami ngayiphothula ngo-2019.
So you conducted a community service.
Yes.
You started from 2020.
Umsebenzi wami-ke usebenza emphakathini wona ngawuqala ngo-2020 lokho besithe yi-COMSEP.
Prior to the examination of accused number 2, you had 6 months doing a community service.
Yes.
Ngaphambi kokuthi ngisebenze ngaye noma ngihlangane naye-ke ummangalelo wesibili-ke nganginesikhathi singange-6 months ngiwenza umsebenzi.
Were you working under supervision?
During my COMSEP?
Yes.
Once immediately we work under supervision within the 3 years of our studies, but once you actually take oath, you are considered to be independent to work in a format whereby you work alone, but you have a superior supervisor that only in instances whereby there are complications that you also don't understand, you refer to them, complications.
Uma sesiqala nje kwiminyaka yethu yokuqala-ke emithathu masiqala yila usebenza khona-ke ubhekiwe noma-ke kukhona-ke umuntu okubhekile-ke noma lokhu kuthiwa-ke i-supervisor-ke kodwa-ke uma usuqala ukuthatha isifungo noma usufunga-ke yila ubonwa khona-ke nanjengomuntu oyimele kodwa ukhona-ke ongaphezulu kwena-ke uma kuwukuthi kukhona-ke okukudidayo bese kudlulisela kuloyo.
So you took an oath after 6 months?
No.
After you examined?
No.
Or before?
Take it before.
Sorry.
When you actually there are 2 different oaths that you take. You take an oath before you even start seeing patients when you're still in school, and there's another oath that you're taking to show that you are suitable and you have graduated and you have passed all the standard that the degree requires, and you are able to be on your own and you can supervise the person. Meaning within a year, I can be able to even supervise a person who's like a year behind me.
Okwenzekayo ke lana ukuthi ke uma usufunga kufunga kabili ke khona la ufunga khona ke ngaphambilini uma kusesesikoleni ke ngaphambilini kokuthi ke ubheke ama patients bese kuthi emuva kwalokho ke yila ufunga khona ke ukuthi manje konke lokho izifundo lezi noma i-degree ekudingayo noma ekufunayo usundlulile kuona waphasa ke futhi ngiyakwazi ke ukuthi ke emuva konyaka nami ke sengingathi ke ngibhekeke noma ngisupervise ke omunye ongemuva kwami ngonyaka.
Have you encountered a situation where the police officers, you testify about prisoners that are brought to you and you said in 2020 in June, have you encountered a situation where the police will confront you with the request of conducting a dental?
Remember in our year of studies, we are in Medunsa. Medunsa is one of the biggest oral health centers in Pretoria. So we used to always, there was a module that whereby anyone is supposed to at least have treated people that are from public, whether it's from president and whatsoever. So we used to get maybe in a regular base, you used to see maybe I would say 2 or 3 prisoners maybe in a month. So they used to always come, and when they come, the protocol is they come to you and then they explain what the patient is complaining about, and then you continue communicating with the patient regarding that. So yes, I have in more than one occasion.
Ngihlangeneke ngaphambilini ke namaphoyisa ke noma ngikhulumisana namaphoyisa uzokhumbula ukuthi besifunda khona eMedunsa yona ke enkulu khona ke ePretoria kuba khona ke imodule noma izifundo ke la khona ke kufanele uhlangane nabantu bangaphandle kulabo bantu ke bekuza futhi ke iziboshwa lezo ke bese ilethwa amaphoyisa likutshela iphoyisa ukuthi ke yini ke isiboshwa esikhala ngayo bese ke ukhulumisana nesiboshwa emuva kwalokho.
I put it to you now before I rest. I put it to you that on the day you conducted a general examination from accused number 2, you infringed upon his right to privacy. Especially, you breached the confidentiality of accused number 2 in relation to his medical status. What is the comment on that?
Now my question is, in which format? How did I do that? If this is, I'm saying if this is a form that's created by the state, which is the one that also everyone serves here, that we're supposed to question an individual who's coming to us and ask these questions, and we decide to ask them the way in which the form is decided, I'm basically saying it was me doing my job.
Uma uthi ke angizange kwenze kahle ke umsebenzi wami ke nokuthi futhi ke amalungelo akhe ke umsola ke noma umangalo lesibili ke ngazange ke ngenze ngokwendlela ngokuphathelene nawo ke usho kanjani ke ngoba konke ngakwenza ngokwalendlela ke ekubhalwe ngayo kuyona le form imibuzo engibuza ngibuza yona imibuzo ekhona la ngenza umsebenzi wami.
Last question. You were asked by my colleague as to when you're conducting that examination, you said accused number 2 Fungantanzi looked worried. What do you mean by that?
Worried meaning, or the patient, the facial expression, the way in which they were, he looked kind of concerned. I wouldn't say maybe it's they are stressed or whatsoever, but they looked confused. Worried meaning they look confused. They looked like, I don't know whether they don't understand the setting or what was happening, but that's a normal perception of any dental patient that's there. I tell you, any adult will tell you here that the moment they enter any dental practitioner's office, they start wondering what's going to happen next.
Lana engangikusho ke ukuthi ke manje ngikhulume ngegama ke uWaret ngaphambilini ukuthi ke wayibukeka ke edidekile ke ungathi ke akazi ke ukuthi ke kwenzekani ke lana ungabuza noma umuphi ke kulaba abahlezi lana ke ukuthi ke noma umuphi ke umuntu omdala uma engena ke la ukuzothi kusetshenzwe khona noma ke akhishwe izinyo noma kwenzeke nike ila aqala khona ke ukuthi manje sengasazi ke ukuthi yini ezokwenzeka manje.
Say on the form where it says complaint, main complaint, you see there. So it appears that it's written the patient requested. Can you read that for me, please?
It says the patient requested an examination for oral cavity.
What do you mean by that if you were approached by the police?
It means that I was informed what the patient is requiring to be done to them.
Lana ke engikufundayo ukuthi ke patient yase icela ke ukuthi ke kubhekwe noma kuhlolo ke la kuyena ke emlonyeni kusho ukuthi ke ilokhu engakutshelwa ukuthi yini leyo muntu ayizele.
So that is hearsay. You were not directly informed by accused number 2. You were informed.
I'm going to go back to protocol. We, as medical professions, is every single time whenever a prisoner, it's not the same as a normal individual. We are supposed to be protected by the people that come with the prisoner. So our interaction before we even go to the patient, with the patient being there, the policeman or the warden must be able to explain to us what we're supposed to do towards the patient, because that's for our safety. That's one of the things that's supposed to have been done there. Because if the prisoner comes in, the policeman goes outside, and then I engage with the patient there, we're not really sure what I'm actually the patient is there for. So we need briefing from the person who's bringing them. It's as if to us it's as if it's a guardian. The patient who's bringing them, why are they the patient there in the first place? So that's why we're saying the main complaint is that.
Lana ke masikhuluma ngesiboshwa ke okuzothi ke ukhona ke umehluko phakathi ke nomuntu ke oyibuyela nje emphakathini ke noma oyibuyela ekhaya oyihambelayo, ngoba lana ke kufanele siholwe yilo noma yila isiboshwa ayisihamba nabo beyibona ke abasichazelayo ukuthi uze ngani lo muntu lana ngaphambili kokuthi singapho noma ukuthi iphoyisa liphume ukusushiyeka uyasala ke nesiboshwa sona bewuyisona esikutshelayo uqala kulabo abahamba naye.
All right, there's one thing that I wanted to clarify before I step down. When accused number 2 was brought to you, was he brought to you by the members of the correctional services or by the police wearing civilian clothes?
There were my recollection of the people at that day. There were men that were in uniform, brown uniform, of which from ever since we've been seeing prisoners, we know they come with that. They come with the prison orders, which identifies that. And there was another one who was not dressed in a brown uniform. So maybe I assume that could be the police corps in that state.
Ma ke efika ke wayihamba ke nalabo kuzothi basebenza ke ejele babegqoke ke uniform ebrown bese kuba namunye ke noma abanye ke babengaqhokile iuniform bona engayicabangelaka ukuthi ngaba amaphoyisa noma iphoyisa.
According to his version, those people were not from correctional services. They were Metro Police officers from SWAT. Just to put it clear that accused number 2 was not brought from prison, but from police station.
So, but not from my recollection, I remember someone dressed in brown. I don't know what was really happening in that point of view, whether it's correctional service. That's what I'm saying. From my knowledge, people dressed in brown are people from correctional services.
Angazi ukuthi ke babebuya ke ku Metro Police, mina ke angazi ngabona nje abantu ababegqoke ubrown, ngoba ke mina ngokwazi kwami ke uma begqoke ubrown ilabo abasebenzela correctional service.
Thank you, Manot. I have no further questions.
Yes, Mr. Mnisi.
I've got 1 question, 2 questions now.
4.
Thank you, sir. Thank you, Dr. Hlokwe. When you were still a student at Medical University of South Africa, was Professor Mokgokong still a Vice Chancellor and Rector?